Does Medicare cover or not cover long-term care costs? Well, here to talk with me about that is J.O., author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
Pleasure. So there's a great misperception around what Medicare covers with respect to long-term care costs. Care to debrief us?
I think the first thing that people should know is that we don't have a national strategy for long-term care services. Medicare only covers skilled nursing facility care for a limited period. The first 20 days cost zero, but you do need to satisfy Part A requirements, which are, and there are two. The first one is you need to be inpatient hospitalization, and that must last over 3 days. And by 3 days, what I mean is you cross 3 separate midnights. From there, from day 21 to 100, there is a copay. But after day 100, you are responsible for 100% of all of the cost. And therein lies the issue, because in this day and age where medical services, healthcare services allow for a person to be able to still be here with us, but still require skilled nursing facility care, that can be a daily cost and racked over a number of years, creating substantial financial distress on families.
So I've heard of instances where people have gone into a skilled nursing facility after their 3 midnight stay, been discharged, and then get readmitted into a hospital, spend another 3 days, and then can return to a skilled nursing facility. And they can do that an unlimited number of times if that were the case?
In theory, that is correct. Now, the issue is that when you go back into the hospital, you can't be going back to the readmitted for the same reason. So as a result, you're going to have, there's different rail guards, if you will, requirements, criteria at which you can be able to go through the process that you described. Generally speaking, that's not a frequent occurrence.
Right. And what about other types of services that might be covered, such as in-home care or hospice care?
So let's first go in reverse order. Hospice care is actually covered by original Medicare, by Part A. So that part is not part of our conversation today. As far as other services, if you will, what in-home healthcare, for example, to the degree that the service is a medical service, a healthcare service, and it is approved by a medical doctor or qualified healthcare professional, then your rehabilitation, for example, for joint replacement surgery can be conducted at home and still be covered by Part A under skilled nursing facility care.
So given that Medicare ultimately doesn't cover these long-term care costs, folks have to rely on what? Personal savings, loans, long-term care insurance, Medicaid?
So yes, there are a number of different programs. And here the takeaway for the audience is that state by state, these rules can vary. So for example, in a couple of years ago, Washington State actually instituted mandatory long-term care services, meaning that you needed to purchase or you were taxed, and creating a limited set of skilled nursing facility care, kind of as the same thing as insurance. There are other long-term care partnerships, if you will, which are done on a state-by-state basis, meaning that if you are an owner of a long-term care policy, depending on this specific policy, that could protect your assets up to a higher level then, and still you could then be a recipient of under Medicaid. And so it's a very, very complicated set of combinations here, basically all dealing with the fact that we don't have a national strategy. So as a result, the states have different stresses. Insurance is regulated at a state-by-state level, and the commissioners of different states are addressing this obvious demand, this obvious ongoing, inevitable demand in different ways.
Yeah. If memory serves, Jay, I recall, I think lawmakers in D.C. did attempt to create a national long-term care strategy, but it never really went anywhere, if memory serves.
Well, the question is going to always be, how are we going to pay? Because the issue is so large that it's just not clear how you would pay and administer. It kind of dovetails with what you had asked, which is that, for example, long-term care insurance, compared to the past, the number of carriers has declined precipitously. In addition to that, there are hybrid new products which combine life insurance and, in a certain case, an annuity, along with attachments which look and feel similar to long-term care insurance. They are not precisely the same. So obviously, I'm the biased. I'm, as broker and certified financial planner, these differences, these nuances are very subtle. And as a result, should be approached in that way, handled very, very carefully.
Well, Jay, I think for the moment we've covered as much as we can about Medicare and long-term care costs. Anything that we missed, though, or anything that just bears reemphasizing?
Well, I think the first thing is that depending on where people live, if this becomes a concern, that they should at least reach out to person so they get a overview about what can exist based on the person's background and experience. For example, we have not even mentioned the fact that there are limited services for veterans that people do not fully tap into. In other words, you'll want to see what the full suite of possibilities is. And the way to do that is to contact someone qualified to help you define the boundaries, the goalposts, so that you can understand what you face.
Jay, it's always great having you share your knowledge and wisdom with our viewers and our readers. Thank you ever so much.
The privilege is mine, Bob.